Good morning, good afternoon, and good evening. I would like to start by wishing all Muslims Eid Mubarak, Eid al-Adha. And I would like to congratulate the Kingdom of Saudi Arabia for the steps it has put in place to make the Hajj as safe as possible this year. This is a powerful demonstration of the kinds of measures that countries can and must take to adapt to the new normal. It's not easy, but it can be done. The pandemic does not mean life has to stop. We must all learn to live with the virus and to take the steps necessary to live our lives while protecting ourselves and others, especially those at the highest risk of COVID-19. As you know, one of those groups is older people, especially those living in long-term care facilities. In many countries, more than 40% of COVID-19 related deaths have been linked to long-term care facilities, and up to 80% in some high-income countries. Recognizing the critical nature of this issue, WHO has released a policy brief on preventing and managing COVID-19 in long-term care facilities. The brief lists key actions that must be taken by policymakers and national and local authorities to protect older people. These range from integrating long-term care in the national response to mobilizing adequate funding, to ensuring strong infection prevention and control, to providing support for family and voluntary caregivers, and much more. For each policy objective, the document lists actions that long-term care facilities can take and gives real-world examples of actions countries have taken in each area. The brief also suggests ways to transform long-term care services so that older people can receive quality care that respects their rights, freedoms, and dignity. I especially want to acknowledge those who work in the long-term care facilities all over the world, who are doing heroic work to save lives and protect those in their care. I salute you. Although older people are at a higher risk of severe disease, younger people are at risk too. One of the challenges we face is convincing younger people of this risk. Evidence suggested that spikes of cases in some countries are being driven in part by younger people letting down their guard during the Northern Hemisphere summer. We have said it before, and we will say it again. Young people are not invincible. Young people can be infected. Young people can die. And young people can transmit the virus to others. That's why young people must take the same precautions to protect themselves and protect others as everyone else. They can be leaders. They should be leaders and drivers of change. All of us have a role to play in reducing our risk of exposure to COVID-19. Every day, we all make decisions that affect our health and the health of those around us in many ways. Reliable information is extremely important in enabling people to make the right decisions for their health. We have all seen the harm done by misinformation. But information alone is not enough. People make decisions based on a wide range of factors to do with their culture, beliefs, values, economic circumstances, and more. They make decisions under unprecedented financial and social pressure, high levels of anxiety, and with ill-equipped health systems. countries have been asking their citizens to understand their risk, to adapt, to engage, to give up to things they value and that define them. In the face of the COVID-19 pandemic, countries are using a range of tools to influence behavior. Information campaigns are one tool, but so are laws, regulations, guidelines, and even fines. We're learning what works and what doesn't. That's why behavioral science is so important. It helps us to understand how people make decisions, so we can support them to make the best decisions for their health. Today, I'm proud to announce that WHO has created a technical advisory group on behavioral insights and sciences for health. This broadens and deepens WHO's existing work on behavioral science and will support our work to offer health advice that's not only stronger but more effective. The technical advisory group consists of 22 outside experts from 16 countries with expertise in areas including psychology, anthropology, health promotion, neuroscience, behavioral economics, social marketing, and more. This new group will advise WHO on how to increase and improve the use of behavioral and social sciences in a range of health areas, including COVID-19. I would like to take this opportunity to thank my colleague Elena Altieri, who proposed this idea a year ago and has worked hard to make it happen.